Assalamualaikum and very good morning Malaysia. Now you are watching House of Health. Today we are going to discuss about new topic, which is smoking. As we know, the smoking case not only come from adults, but it also come from teenagers, which are easier to spread because of the nature of wanting to try something new. To better understand this event, we will talk with Professor Dr. Anissa Sahar, who is a health behavior expert especially in smoking cessation and workplace health promotion at the National University of Malaysia, UCAM, as well as Dr. Maya Imran in conclusion physical therapist from University Malaya, and we also have Ms. Zahira from Malaysia International Humanitarian Organization (HM). As we know, cigarette have a harmful substance such as tobacco. Tobacco contains a poisonous substance that affect people's health. Two of poison are carbon monoxide and tar. So, Professor, can you explain how does smoking can affect the body?
Smoking cigarettes can have many adverse effects on the body. Some of these can lead to life-threatening complications. In fact, according to the Centers for Disease Control and Prevention (CDC), smoking cigarettes increases the risk of dying from all causes, not just those linked to tobacco use. Smoking cigarettes affect the respiratory system, the circulatory system, the reproductive system, the skin, and the eyes, and also increases the risk of many different cancers. Moreover, smoking cigarettes can damage the heart, blood vessel, and blood cells. The chemicals and tar in cigarettes can increase a person's risk of atherosclerosis, which is the build-up of plaque in the blood vessels. This build-up limits blood flow and can lead to dangerous blockage. Smoking also increases the risk of peripheral artery disease (PAD), which occurs when the arteries to the arms and legs start to narrow, which restricting blood flow. Research shows a direct link between smoking and developing PAD. Even those who used to smoke face a higher risk than people who never smoke. Having PAD increases the risk of experiencing blood clots, angina or chest pain, a stroke, and heart attack. In addition to the well-documented link with lung cancer, smoking cigarettes can also contribute to other forms of cancer. The American Cancer Society reports that cigarette smoking causes 20 to 30% of pancreatic cancers. People who smoke are also 3 times as likely to develop bladder cancer than people who do not. Smoking cigarettes also double a person's risk of stomach cancer. Tobacco is especially linked to stomach cancer that occur near the esophagus. Cigarettes can also increase the risk of mouth cancer, laryngeal cancer, throat cancer, esophageal cancer, kidney cancer, cervical cancer, liver cancer, colon cancer, and acute myeloid leukemia.
Thank you for the good information, Professor Anissa. This is crucial for everyone to take note. Okay, next, we continue with the Dr. Maya Imran. So, Doctor, is there any ways to prefer from smoking? Thank you.
Yes, of course, quit smoking is very challenging undertaking that often requires several attempts before you can successfully and permanently quit. If one method doesn't work, try another. The important thing is just to keep trying. Different people choose different strategies to quit. Smoking tobacco is both a physical addiction and psychological habit. Smoking can be a way of coping with depression, anxiety, or even boredom. There are many different ways to quit smoking. To succeed, you have to find a smoking cessation plan that works for your personality. Some people use e-cigarettes to get rid of smoking habits. For instance, like vape. E-cigarettes produce an aerosol by heating a liquid that usually contains nicotine, the additive drug in regular cigarettes, cigars, and other tobacco product, flavorings, and other chemicals that help to make the aerosol. Users inhale this aerosol into their lung, so it is quite harmful. The ways to prevent smoking are: first, to get rid all the cigarettes and anything related to smoking, like ashtray and lighters. Second, live with another smoker. Ask them not to smoke near you, or convince them to quit with you. Third, when the cravings hit, don't focus on them. Cravings are temporary, so focus on why you want to quit instead. Fourth, keep yourself busy. Change any activities connected to smoking. Take a walk or read a book instead of taking a cigarette break. Fifth, when you get the urge to smoke, take a deep breath and hold it for 10 seconds and release it slowly. Repeat this several times until the urge to smoke is gone. You can also try meditation to reduce baseline stress levels. Sit, tell friends, families, and co-workers about your quit date. 7. You can also set up a support system, such as a family member that has successfully quit and is happy to help you. 8. Avoid places, people, and situations you associate with smoking. Hang out with non-smokers or go places that don't allow smoking, like movies, museums, shops, or libraries. 9. Don't substitute all food sugar-based products for cigarettes. These can cause weight gain. Instead, choose low-calorie, healthy foods. Try carrots or celery sticks, sugar-free hot candies, or gum. There are 5 types of NRT, which means nicotine replacement therapy, patch, gum, nasal spray, inhalers, and lozenges. Last but not least, don't forget to exercise because it has health benefit and helps you to relax.
I suggest people can apply this way to quit smoking. And Ms. Zahira, is there anything you want to share with the audience?
I want to share about spreading awareness of smoking. First of all, what is the meaning of spreading awareness? The definition of awareness is a state of knowing and being informed of something, sharing information to a certain group of people. Being informed about the problems or bad side effect of smoking is an example of having an awareness of the problems. Next, why should we spread awareness about smoking? We should spread awareness about smoking because we need to protect our environment. For example, we need to acknowledge people do not smoke to protect the environment because if the generation condones smoking, it will lead to global warming. Moreover, we should spread awareness about smoking because, like people always say, prevent is better than cure. They need to prevent from getting chronic diseases such as heart disease, cancer, and diabetes because that can lead causes of death. Next, who should spread awareness about smoking? Social media, society, and government. How to spread awareness about smoking? First, using a social media. Social media is a powerful tool for spreading awareness. You can easily find like-minded individuals through forums, Facebook groups, and Twitter hashtags. You can even connect with people from overseas to create an even wider network of advocates. Second, do a campaign related with smoking to increase awareness and the intention to quit among smokers. The intention to quit among smokers is based on information, motivation, and the availability of quit smoking. Smokers need to get the medical consultation and information about the consequences of tobacco use, for example, anti-smoking campaign. And lastly, government has implemented a ban of smoking indoors and open-air restaurants, including intensifying its enforcement. The government also had previously enforced the smoking ban, gazetted in accordance with Regulation 11, Tobacco Product Control Regulation 2004. Under the rules, any individual who violates it can be fined not more than 10,000 or imprisoned not more than 2 years.
Thank you for the sharing, Ms. Zahira. Okay. Professor Dr. Anissa, Dr. Maya, Ms. Zahira, thank you for joining us today and giving the inputs about smoking.
Thank you.
Thank you.
Thank you.
I learned a lot, and I'm sure the audience at home did too. I encourage all of you must think about this discussion very well. Have a great day, and thank you for watching us. Come back with the health of health. And the next week at the same time, same place. See ya.